International Science and Technology Center, the ISTC.
It is not really effective in certain situations. It's not really effective with certain countries.
Very, very difficult for them because they had a lot of stigmatization from the population.
Or specific COVID laws that I'm going to go into a bit more detail about later, but there's a general theme that legislation enables emergency powers and special measures.
Эта конференция очень важна для специалистов и экспертов по биобезопасности, по биологической защите и не только для них, потому что биобезопасность и биологическая защита подразумевают включение многих специалистов, таких как правоохранители, оборона, госбезопасность и так далее, потому что это же выходит за рамки лаборатории и включает в себя и кибербезопасность, в том числе и физическую защиту.
So it is important that there is a sort of supervisor or there is written on a paper the procedure in order that you are always able to control in which step you are.
For people using glasses, this is not feasible because you have also glasses that harming you on the face.
Recognition of our state-of-art facility and trust what we do here at Google and how transparent our job is.
COVID-19 pandemic has made clear that we, as a global community, have more work to do in this space. We need to strengthen biosafety and biosecurity around the world.
An initiative that aims at a really comprehensive approach to addressing risks linked to chemical, biological, radiological, or nuclear materials.
So far in our workshop we have achieved to be able to make the participants understand how do they need the country to get ready in preparedness if there is a new pandemic that is coming, through exchange with the participant and through exercise that we have created for them to understand the benefit of preparedness at the country level and at each laboratory level.
Indeed, the Liver Lab played such a significant role in the response here to COVID. It's extraordinary. Our response in the United States was not nearly as good as here in Georgia. So I'm so proud of what you have accomplished.
We are a biosafety organisation that goes across boundaries and it goes across countries. And because of that, we don't tell people how to conform to legislation in their countries because we can't. We have many countries.
The largest investment what was made in the development of the unified laboratory surveillance system in this country, built with 22 labs. The referral lab of Google, which was mentioned several times, and it's the flagship lab, plays significant role in many directions, was done by the personal support of
I'm the co-program director for national implementation at the Verification, Research, Training and Information Center, also known as VERTIC.
Даже несмотря на то, что это была ситуация с пандемией COVID-19, наша команда смогла даже в это тяжелое время разработать 14 пакетов по обучению лабораторных специалистов.
Well, this conference is a very important event bringing together a lot of participants from across this region. I think in terms of really results, what we are seeing here is a lot of very good discussions among professionals, also coming up with ideas. And from my perspective, from the perspective of someone working in the European Union as a donor, we are looking for ideas about new directions of new kind of actions that we could fund to address biosecurity and biosafety risks.
20. We are funded under Project 53, which is implemented by the ICC and most importantly by Henk Visser.
1,657 incidents related to COVID. In other words, not COVID positive. Of our 5,071, 2,233 required some sort of medical attention. They reported that they'd been to see the doctor or the nurse.
С 19.09 по 25.09 18 случаев ввоза из Турции, Великобритании, Италии по 3 случая, Польша, Болгария по 2 случая, Венгрия, Украина, Сербия, Румыния, Исландия по 1 случаю.
This particular university, as yours and others I know, are offering core modules to students who are going through the programs in microbiology and biomedical sciences, which is equally important, and that also needs to continue and needs to expand.
Она очень выросла. Лабораторное оснащение, лабораторная работа, как медицинских, так и учебных работников очень выросла. И поэтому сейчас можно сказать, что они работают надежно, безопасно и готовы встретить новые последствия.
Оффлайн встречи, они дают больше пользы и информации, потому что оффлайн встречи, они проводятся в широком формате. И по времени, скорее всего, они не ограничены. То есть этим вопросами заниматься можно целый день. Уделять большое внимание именно с глазу на глаз. Передаются не только сухая информация, но передаются эмоции. И на практике все это показывается воочию.
Geopolitical scenarios development provisions, and where biological warfare and bioterrorism could be just considering that the key elements of the future combat activities provisions, functionality and modality.
To analyze our results, we using the questionnaire method, the quantitative and quantitative method. So we give our participants 2 questionnaires.
Мы всегда даем направление и правительству, и чиновникам, и фермерам, бизнесменам. Даем им понять, что мы, Кыргызстане, должна быть такая политика, что жесткий контроль за модифицированных семян сельхозрастений.
Растения болеют так же, как и люди. Хотя многие этого не замечают. Это болезни, вызванные патогенами или вредителями.
So the result is, as I mentioned, is the networking, but I think also part of the results was as part of this conference, because it was on COVID-19 lessons learned. We were aiming to try to formulate some recommendations or observations, what exactly are the lessons learned, and the aim is to write these up in some white papers, and then we'll submit these to all the participants, and they can share them with their governments to kind of highlight what the lessons were, as well as I will share them with international funders to kind of identify what the needs are in the various regions of Central Asia, the Caucasus, Eastern Europe, and hopefully that will lead to us being better prepared for the next pandemic.
During the pandemic, like many of you, we all had a very large initial workload, but we were trying to work out what was happening. And as the virus spread around our own staff, we're seeing reductions in numbers of staff and increased workloads.
Мы проводим и обучение тренеров, но в том числе при необходимости обучаем просто рядовых медицинских работников, в том числе и средних медработников.
My name is Alex Lee. I'm from the U.S. Department of State, the Biosecurity Engagement Program. I would like to thank you all for attending this conference and to participate in all of the very important conversations regarding biosafety and biosecurity.
Спасибо большое. Thank you very much for opportunity to present my results, my work in this conference. And I am very happy to be here, and I hope that we to meet in other conference and other conference with you. Thank you very much.